Hi, I'm just going to show you a couple of cases that I got on ruptured ectopic pregnancies, one involving the ovary and the other involving the fallopian tube. So this first case is a ruptured ectopic pregnancy and located at the ovary. So in this picture here, this is the fallopian tube, and this shows the ovarian capsule and the chorionic villi and the corpus luteum here within the ovarian tissue here. And as you can see, the chorionic villi is sort of within the ovarian tissue and involving the corpus luteum. And this is a higher power of the fallopian tube. So if you recall, the fallopian tube is composed of ciliated columnar epithelium with intercalated cells lined by fibromuscular stroma. And this is a higher power view showing the chorionic villi in close proximity with the ovarian stroma and the fallopian tube. And the ovary located here. And another higher power showing chorionic villi. This chorionic villi is lined by syncytial trophoblast at the outer layer and cytotrophoblast at the inner layer. And these are the intermediate trophoblasts. And adjacent to the chorionic villi, there will be corpus luteum. And corpus luteum is composed of luteinized granulosa and theca cells, and they happen when following the release of ovum from the ovarian follicle, while corpus albicans is a form of degenerated corpus luteum. And this is a higher power of corpus luteum, showing the luteinized theca cells and the luteinized granulosa cells. So for this case, we diagnosed the case as ruptured ovarian ectopic pregnancy because there is presence of chorionic villi inside the ovary. And this is quite a rare case because usually ectopic pregnancy happens within the fallopian tube. But in this, it still can happen in the ovary. Okay, so we move on to the next case. Okay, this next case is a case of tubal pregnancy. So in this case, we see a fallopian tube which has lost the mucosal surface epithelium and but still retains the fibromuscular stroma surrounding it, and there's presence of fetal tissue at the side here. And how do we know it's fetal tissue? Because fetal tissue are composed of small round blue cells, and in this case some of them are organized into forming cartilage, and some of them are forming gastrointestinal tissue that you will see later. So this is a view of the fallopian tube, and it has been disrupted. The epithelium has been sloughing off, and you don't really see a nice surface epithelium here except for the area at the top here. And there is presence of fetal tissue here, and these are the ones that are forming cartilage at the side here and probably forming bone as well. And you see these cells are already forming gastrointestinal tract, and there's probably fetal liver here as well. So in this case, we don't really see exactly a ruptured fallopian tube containing all of this fetal tissue, because we don't really see a muscular disruption of the fallopian tube aside from the sloughing off of the surface epithelium. But because the clinicians have indicated that this is a ruptured ectopic pregnancy, and you see the fetal tissue here, and the dilated fallopian tube as well. So the diagnosis is consistent with ruptured ectopic pregnancy. So in conclusion, ectopic pregnancy does not just happen within the fallopian tube, but it can also happen anywhere, including the ovary. And tubal pregnancy, you can still see chronic villi, but sometimes the fetus has already developed and you can see fetal tissue inside the slides that you get.